and allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So I need a motion for the approval of the minutes of last month.
Second.
All right. All in favor?
Aye.
Any opposed? Motion carries. You're up.
HE1 is a resolution requesting to authorize Oswego County to enter into a proposed intermunicipal agreement with 7 other upstate counties in order to ensure adequate public health services in the event of a public health emergency. We have been part of this agreement since 2014, and it is up for renewal.
So moved. Second.
Say the word. I had to learn how to say that word. Yeah.
What one?
The word that's in the word that's in the heading.
Oh, epidemiological.
Epidemiological.
That must have been one of your spelling words in school.
I've been practicing that so that.
Oh.
Okay. Any questions? I mean, that was pretty clear.
Yeah.
So everybody understands that if this ever triggers, the county requesting the help reimburses whatever county's assets, resources, people that we put in place to assist them. So it's the same way if something happened here and we put that call out, then it would be our responsibility to cover that cost for other counties. So it's a good thing.
What drove that plan to be able to do this?
I think it's just part of the alliance that we work with all upstate counties. It was established in 2014. It could have been an H1N1 where we had to vaccinate with the flu that came out that was very deadly at the time. That could have been.
I wonder if that's an alliance worked on that, I think.
That's correct.
I wonder if there's an alliance we could set up like that for DSS, you know, because we were talking about this a little bit yesterday. You know, one of the things I noticed when we went over their yearly report, we're behind in so many different areas, and the question was, what's the state doing for us to help get us caught up, or to help do things, or do some relief? And this is an interesting thing that they're doing here. It'll be interesting to see if that's something we could do with counties from a DSS standpoint. Have a team that could go help bring them back into line. So, I don't know. Thought.
Set up similarly, there's social services districts and there's health districts.
Right.
So,
I mean, you do it in manufacturing all the time.
yeah.
Yeah. The IL centers do it.
Yeah.
If we have something going on.
I think the thing to look at is we look at the statistics for the surrounding counties, see if they're in the same boat we are. Then
Well, yeah, that would be difficult, but you would think the state would put together a team
yeah.
that would go out and help.
Well, Phil just hit on it. Every county around us, the whole state's got the same issues. You know, here you've got to have a degree and to work on a lot of these jobs, and they pay them 38, 30, I mean, we pay them jack for it. It's crazy.
Yeah.
Any other questions on the resolution? All in favor?
Aye.
Opposed? Motion carries. Number 2.
HE2 is a resolution to request an increase in fine revenue and associated legal fees for the sale of illegal flavored vape products. Several businesses were found to be in violation, and hearings have begun to set fines. With these hearings come an increase in legal fees. Some of the hearings have concluded, and we would like to use a portion of these fines known to us but not yet received to offset the increased cost of legal fees. There will be no local share impacts. We are requesting to increase the fine revenue line by $15,000 and increase legal fees by $15,000.
Who's actually covering these legal
I need
fees?
a motion first.
I get a motion. Second.
Second? Go ahead.
Who covers these legal fees?
Cover it.
Yeah, in other words,
Well, that's the first-
is the county covering, I mean, is our county attorney's office handling this?
It's not, if you take a look, we did have to change the budget modification because legal fees is for payments to attorneys. So the types of
Our
Thank-
hearing attorney, our hearing officer,
hearing officers, transcripts, things like that would come out of other fees and services. So we changed the budget on it's the anticipated revenue is coming into the right line, but we need to increase the expense in the other fees and services because it's not necessarily attorneys that are going to pay.
Understood.
Right. Because it's kind of, I can see why you
Mike, I
think
have a
it was
question.
legal. Yes.
So, when we originally did this, we had it in other fees and services, so we had it in the correct spot originally. It does not go into legal fees.
That's what my auditor and county attorney
Okay.
told me, that legal fees is generally payments to attorneys to provide an attorney service.
Okay. I wasn't aware it was switched back, so I just want to make sure I have my ducks in a row.
Yeah.
Thank you.
this one was the
So I don't know when that got changed,
Okay.
probably, but.
Yeah, it was originally budgeted there, so
Okay.
it was right in the first place.
All right.
Thank you.
Could be a misunderstanding of what was
Yeah,
written,
yeah.
and that's why we changed it, but,
Okay,
that doesn't need to be in legal fees.
perfect. Thank you.
So what they're doing is using the fine monies to pay for those services.
Understood.
Good? Any other question?
Yeah, I do. Our health department closes it down or the state does?
It depends on, like a cease and desist order.
Yeah.
The health department can do that for a restaurant or a camp. But for tobacco, we would work with the state. We would work with the state.
And
I
they should
think
pay
that-
for it then.
We just fine them.
Because
We go in and
reason-
do the inspections, and then if we find the illegal product, we'll fine them based on the illegal product.
The reason I asked that is I was in New Hartford this weekend, in the strip mall I was at, there was a vape shop right there, and it's a great big blue sign, the state, and it's tarp, the place was tarp, the whole 9 yards, and the state closed it down.
Yeah, it would
That- I mean, that
we
was
would work
clear.
with the state for that.
They probably control the licensing for them.
That is
Right.
correct.
Yeah, so I don't know why we'd have legal fees there, to be honest with you, that's all.
The legal fees are the process after they seize the product that's illegal, and then there's a process for fees imposed. The Board of Health then makes a decision on where that fee falls and the amount. In fact, you imagine Friday, we're about ready to wrap up some of these.
That's correct.
So that's why this is here, because
I think
they've
that
incurred a lot of cost in this.
from hearings that people have a right to a hearing, the business owner, and then to lessen the amount of the fines that they've received. And then the Board of Health will agree with their proposal or not agree with their proposal.
So there's a local process that we have to pay for ourselves, so we do it through the fines.
Right.
Right?
Very quick, because they're just, Fulton's gonna be turned into, we change the name to Vape and Smoke Shop City. Because they're popping up again. But one that was fined and closed, I believe, Fulton Cigar and Vape Shop. It's in the Canal View Mall.
Yeah.
Okay, it reopened, okay, and I know it's the same owner, they just changed the name. And that's,
It's one on our list.
that's kosher to do, or what?
They can, there's a lot of,
All you gotta do is change the name, you know, it's like changing your last name to be able to get yourself a license of some sort.
that's correct. There's a lot of loopholes, and owners of these shops that sell illegal products are they know their loopholes.
Well, it's
So it's
their
difficult.
fault because they didn't code it correctly.
And we had a discussion with this
Thank you.
NISAC in the spring, the public health, and it was quite a discussion because it was several people in the room understood everything, but there were quite a few people in the room that didn't even know the process. And they were quite surprised that when we go in, we're only allowed to confiscate, I forget how many units,
Up to $50,000 worth.
up to $50,000, whereas
Which
it
is
should be.
$100 per unit.
Yeah, so it should be, they're allowed to take anything, all of it, if it's illegal, but that's not the way it works. And then just like this, there's always this negotiation piece, and then, like you said, they turn around, they sometimes move to another location, but it's the same people involved and they reopen. And I'm a little confused with some of that because my wife and I used to own the newsstand at Great Northern Mall. So we had to have a tobacco license.
Right.
And it was very clear that if we violated that license, we lost that privilege to sell tobacco in that shop. But that shop actually never was known as a newsstand. It was listed officially in New York State as a tobacconist. And it was the only place in the mall legally, because we were listed that way, that you could smoke in that store.
Right. And that's a license through the ATF, is that correct?
Yeah.
And that's who has the right to shut them down also. And we do check for licenses. Sometimes they do have them, sometimes they do not. And we report to New York State Department of Health, ATF, whoever needs to be notified that their license is not correct.
Yeah, the process needs to be simpler and clearer.
It's a very difficult program.
Go ahead.
Did anybody mention, have you been made aware of one opening on the corner of Hannibal and,
We never get
West
notified of when
Virginia,
one
yeah,
opens.
yeah.
They pop up all the time.
Okay.
We do our best. By tracking them through social media, if they advertise,
it's there,
word of
it's,
mouth.
I know the owner of the
I seen
building.
it.
Yeah, I saw it.
I did.
Are these places filing DBAs when they open?
They do.
Well, maybe we could have an agreement with our county clerk's office to automatically notify the health department of any DBA for post-action.
Oh, that would be wonderful.
That's a great idea. Is that something we have to do in policy or just?
No, so we can just meet Terry and see if it can be done.
Anything else?
That's all I have on
Okay, good. All in favor?
it. Aye.
Opposed? Motion carries.
Requesting the approval of the December 14th, 23 Professional Advisory Committee meeting. From our meeting.
Second.
Thank you.
Any discussion?
No, I have one question.
Okay.
It's a simple thing, but, number 9. Here, on the thing is, what's a leave behind kit? I'm just curious.
That's when we leave Narcan behind at a scene that was received Narcan. So they use their Narcan and we leave one behind, so they have one.
Okay.
That's it.
Anything else? We've been through this before. This is fairly routine. We'll get a chance to review it. Any questions?
Oh, that's a good question.
Okay. All in favor?
All right.
Opposed? Any opposed? Motion carries.
Thank you. I do have your hand up. Does everyone feel these handouts are important? I know we want the overdose data, but I also have in here the environmental data. Does anyone find these useful, or am I giving you too much information?
No, I like it. It's good.
Okay.
That's-
All right, very good. Just wanted to make sure. Like data overload, but it's good information.
More information, the better.
It was a good turnout at the rabies clinic.
Yeah. It was. 198, I believe, is my number.
Good.
So our readiness assessment was submitted to the Public Health Accreditation Board in February, and we actually scored fairly high. I want to say high, but fairly high. A better representation. Enough to show us that we are absolutely ready to apply for accreditation. Accreditation provides a means for the Public Health Department to identify performance improvement opportunities, enhance management, develop leadership, and strengthen relationships with members of our community. Engaging in the accreditation process will challenge the health department to think about its roles and responsibilities and how we plan to fulfill them. I do have copies of our readiness assessment report if anybody's interested in taking a look at it. The copies weren't really great, but all the information is there, and you can see where the areas that we need to work on. But it's a nice little report. It's confidential to the health department, but you are all part of the health department, so I wanted to share it with you. Our Public Health Education Department. So this week is National Public Health Week. National Public Health Week recognizes and celebrates the hard work and dedication that goes into maintaining and elevating public health. This year's theme is protecting, connecting, and thriving. We are all public health. Monday was Kids Day, and we celebrated with a spring carnival. Families enjoy carnival games, a reptile petting zoo with GG animals, sensory play tables from Little Luke's and Pembroke Associates, STEM projects with Novella, adaptive design with Arrive, the American Red Cross Pillowcase Project, presentations from Fulton Dental Health Solutions, and more. Families also learned more about the April 8th solar eclipse and grabbed a free pair of solar eclipse safety glasses while they were there. It was very successful yesterday and a fun-filled day for all. Today is Animal Safety Day, where we have several presentations that are going on right now. One on rabies, one on caring for your pets, tick safety, and others. Activities from a variety of agencies include the Oswego County Humane Society, and several veterinary offices will be there to answer anybody's questions. The county soil and water district is also tabling, and we're handing out mosquito dump kits and tick kits as long as supplies last. Wednesday, together with the Suicide Prevention Coalition and Catholic Charities, we'll be hosting Start the Conversation, a mental health art show. Oswego County High School students and college students' artwork will be displayed, and they were asked to answer the question, what do you do to take care of your mental health? This event will be held at Catholic Charities in Fulton from 4 to 7 p.m. on Wednesday. Snacks and drinks will be available also. On Thursday, the Preventive Health Fair will be allowing residents to register for free breast cancer screening through the Upstate Mammal Van. Will be up right at Funner Street. Also, you can donate blood with the American Red Cross, receive blood pressure checks, get a copy of your immunization records, and meet with the local police and fire departments. Mentor Ambulance will be there, Office of the Aging, and many more will be tabling. Pre-registration is required for the mammogram and for blood donation. Emergency preparedness. We participated in a mass casualty tabletop exercise with a lot of the emergency agencies throughout the county. for the upcoming solar eclipse on Monday. We will have 2 health departments staffed at the EOC during the event. We will be also ready to have a phone bank to be operational if it's needed during the event in case of major emergency, and this will be for any overflow calls that are received from either 911, well, mostly 911, I would say. Or the American Red Cross will be setting up a tent also, so if they have overflow calls, we can assist with those also. OD2A, which is our overdose data, I did hand out a handout, and then the overdose fatality review team is still in the working and planning stages right now. Our Healthy Families program continues to grow very strong. We are now above capacity, so we are over the 100% mark. We have started prioritizing referrals, taking the highest need cases at this time. And for a comparison, last year at this time, we were at 38% capacity. We reached out to OCFS, which is the Office of Family Services, to see if there was more funding available for us so we can expand our program, and right now there's not, but we are on a list and we are looking at other avenues on how to take care of these families. Environmental services, our first rabies clinic was held in Scribo on the 27th. We vaccinated 193 animals, 143 dogs, 47 cats, and 3 ferrets. All of the solar eclipse food vendors that we know of have all been permitted for the event. Engineering services, Camp Derby infrastructure improvement projects will get, they plan on starting construction this summer. New York State Department of Health has approved the Town of Mexico Water Service Area Number 6 project. The Village of Mexico Water and System Improvement Project will start construction in the spring. The Town of Orwell Water System Improvement Project is started last month. The Town of Schuylkill Bankrupt Road Water District will assume construction in April, actually this month. And then the City of Oswego Water Treatment Plan Improvement Project Phase 1 project will be completed this month. Communicable disease surveillance, all respiratory, RSV, flu, and COVID are all on the decline, thank goodness. I'll have those final numbers or close to final numbers in the next couple months. Our lead cases are up to 119. We have 24 maternal child health patients. Immunization clinics remain well attended. And our PCA program, which is our personal care aid program, is transitioning back to DSS, and that is moving forward very well. And that's all I have for my updates.
Nice.
Any questions?
I'd just like to say I'm encouraged by the 2024 confirmed overdose fatalities at 0. That's fantastic.
So far.
So far. Knock on wood.
Knock on wood. Couple suspected, but we'll wait for the death certificates to come up to get that information.
If you notice, 23, we had 22, 29.
So the ones we're showing in February, basically the 4 just aren't confirmed yet?
That's correct.
Okay.
Thank you, Frank.
All right, motion to adjourn?
Anything else? That's it?
That's all I have.
You all set for the big blackout?
I'm ready. I'll be in the cellar.
Thank you.
So that's all right. That's all right. Yeah, we're ready.
Okay. Motion?
Motion to adjourn.
Second?
Second?
All in favor?
Aye.
Opposed?
Am I wrong?